out that door. All right, y'all. I sent y'all all the email with the everything that you're gonna be seeing. So let me get into these slides. Yeah, I just haven't had a chance to upload a whole lot of them. Let me make sure I recorded. I'm sorry, let me make sure I did record. I am recording. So we're gonna get into the pharmacology. Y'all gonna see a lot of this, and it works interchangeably with your pharm. Now the reason being, a lot of issues that you're gonna encounter are respiratory in nature. So you need to understand what kind of medications people may be on and what is going to contribute to their situations. So we got a lot of $10 words that we fixing to get into. Okay, some of them are on these slides, a lot of them are not. So you will need to know them because you will see them on National Registry. Okay. So you can't necessarily administer medications, but you can assist people with what they already have. And typically we want to verify that their name is on the prescription because sometimes human nature, yes, we do share meds. Is it the best thing to do? No, it is not, unless you've already had that medication before and you know how it works in your body. Sure. Yes. Lord Jesus, I emailed y'all the lecture notes because I'm not putting it up there because I'm recording y'all lecture so you can watch it later. Yeah, please mute yourself or don't get the reverb. Okay. Now, in the event you have a question and you are logged on, unmute yourself so that way whoever else is online can hear the question because they may have the same question. So we already know Patricia's online. And I don't know, dang it, I forgot to send it to Maples. One of y'all send Maples the link. Yeah. She's in the other class. That's up to you if you don't want to. Because I'm not putting them up there. The lecture notes, yes. Okay. Now, we're going to look at how to safely help them with medications and what are used in emergencies. You fine. Just mute yourself. Yeah, because of the reverb. That's why we do that. Okay. Okay, thank you. So we're going to look at how you would give yourself medications. Help them out, y'all. How to peer administer
That's
and to assist.
Pick it back.
Bless it. Y'all know he old. Help him out. Okay, so we're going to look at the medications. We're going to look at the names, effects, actions, indications, and contraindications. A lot of this y'all need to understand about these drugs. There are only, 10 medications you can assist with. What you're going to see in the field, let's limit the sidebar because y'all need to understand this stuff. You're going to see a ton of stuff in the field. Are you required to know what every drug does and how it interacts in the body? No. Will you develop that knowledge over time? Yes. Okay. We're going to look at some of our complications, routes of administration. Okay, well, I need her to talk with her notebook to talk to Dr. Lloyd. Yes. The side effects and interactions, okay? So we're going to look at some of our dosages of medications too. You need to know how much you're giving these people or assisting them with because you don't need to give them too much or help them take too much because that's going to cause other issues that we don't want to have to do, okay? So it says on here, medication interventions are important. We're looking to alleviate pain, reduce their symptoms of what's going on. Now, what do you think medications are made of?
Drugs.
That part. But what are those drugs made of? Okay. How do you get the chemicals?
From the environment.
Yeah, I'm like, no, we're not doing pyramid schemes. That's how Bernie Madoff went to jail. I heard somebody say, who was it that said it? Plants is one. What's the other?
Just the environment.
Somewhat. I think that Patricia chimed in. Somebody looking at the chat and, oh no, that wasn't her. Huh? Okay, we got that part because Khalil said the periodic table. Huh? Okay. How many of y'all have old grandparents? Oh,
Yes.
are you joking?
Yes. Yes.
Okay. Most of the time, if you sick, what do they give you?
No, she didn't have a capstone sheet. She got a capstone ride-alongs, but she don't have the ones that Dr. Lloyd signs up for. Did you already print them for her?
Yeah, I did. I got some more I print out.
Okay, I'm gonna have her just go over
Okay.
those each day.
Okay. 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 Each one of those, what are they? Sugar's part of it, but they're natural things. They're foods. Ginger ale should be real ginger ale is made out of the ginger plant. Peppermint is made out of the peppermint plant. Okay. Most of your drugs are either made from a plant or an animal. That's their base. Mm-hmm. Now, most of the things like Khalil was saying in the periodic table are synthetic drugs. Those are the ones we make in a lab. So those are your three bases for your medications. Are herbal remedies medications?
Yeah.
Who said no? Why? In plants, in synthetics. Okay. So when we're looking at things that people are taking, when we're looking at drugs, we have to absolutely factor in how something they may have taken that's considered herbal and natural interacts with this other medications. Reason being, you may mix two things and they have a reaction that you are not expecting that can knock you down or make you sick as four dogs.
Yeah, I had.
Unmute yourself. Well, you're not online, never mind. Okay, well, unmute yourself so they can hear it. Oh, okay.
These pills, and then I had some cranberry pills, and when I took them together, I was
Mm-hmm.
nothing. And I didn't understand why until like somebody told me it was that.
Mm-hmm. Because
You know, like the hair, skin, nail pills, and then the cranberry. I was like, sheesh.
When I had got my concussion, they had me on naproxen for so long, and it ate away at the line in my stomach.
absolutely.
And that's how my ulcer perforated.
And that will happen. A lot of medications can cause other issues in your body that you're not expecting. But if you didn't know that that would happen, you wouldn't have taken as many.
I would think I probably bitch like skillet.
And that happens. You can take something, let's say you're taking a medication for your blood pressure or antibiotic, but then you drink grapefruit or dairy. That can inactivate your medication. So you have to pay attention to what you're taking and what it's made from and what your contraindications are so you know how to best deal with that medication. Okay.
I was told with cholesterol medication that I can't.
Right. And did they tell you why?
I think it's intensive.
It does. It makes some things like grapefruit can make some medications work in what is considered a synergistic effect. It has an added effect and makes it more available in your system. And that's one of the words you're going to need to know. Synergistic. S-Y-N. As you'll be my scribe, please. S-Y-N-G-E-R-I-S-T-I-C. Hmm? I-S-T-I-C. Okay. That's when something has an additive effect. It is medication may have an effect that's multiplied. Okay. If you have something that you give in an unsafe manner, which I know she has taken her cholesterol medicine and I give her something that has grapefruit in it, that's going to have an additive effect to how that medication works. Is it always a bad thing? May not be. Is it a good thing? Could be. But let's say her system reacts violently to that. That makes it unsafe. So let's say she decided she wants to go on a diet and they say, oh yeah, just take these grapefruit pills or this apple cider vinegar stuff and it'll help you lose weight. But the medication she's on can create an unsafe situation with that, even though it's natural. Okay. So that's why we have to be careful of what we do and help deliver medication safely so we do not have these untoward effects. Does that make sense? Now, the purpose of it is to prevent or treat disease. That is the whole purpose of medication. So your disease could be arthritis. It could be that you have depression. It could be that you are bipolar. It could be that you are, yes, to treat or prevent disease or to relieve pain, which is treating of a disease. You could be treating alopecia. It's when you don't have any hair. Okay, so it just depends on what you're treating. That's the purpose of medication. Okay, just like if you technically look at it, food is a drug. You are treating or preventing a disease. What disease are you trying to prevent or treat? Wait, what? Well, no, that's when you eat too much. Yes. What is food as a yes? And if you have excessive hunger, you're treating what when you're eating? Let's use our $5 words, people. That's a different situation. Somewhat, but not really. When you don't eat enough, you're having what situation? Not necessarily. Malnutrition. We got to keep it simple, people. Bad nutrition. You're not eating enough that your body needs. You're not getting those vitamins and minerals. Okay. That is a purpose of food, to prevent malnutrition. Sometimes we like food a little too much. That's when we have obesity. Y'all know I like food.
Bring it back.
Okay.
I am very much so.
And that's a situation. And some people need to have medication that helps them curb their cravings because they want too much of a certain thing, such as sugar or salt or fat. And those are some appetite suppressants that help them control those cravings so they don't eat excessive amounts of it. Okay. Now, pharmacodynamics. This is on your lecture slide. You will see this word again from now until you end up somewhere else in the medical profession. It's a process by which medication works on the body. So anything that you put in your mouth goes through your esophagus down to your stomach, and it is broken down until it passes into your intestines and is processed by your liver to detoxify. How that medication is distributed into your body, how it works itself is pharmacodynamics. Okay. Is that making sense so far? Now, medications can have two effects. It can either work for you, which is an agonist, or work against something in your body, which is an antagonist. So what's an example of an agonist? Something that works with your body. That is a different kind of situation. I know where you're trying to go with it. I'm thinking things that are already in your body. Yes, well, melatonin, that's a whole different thing because it helps stimulate sleep. Serotonin and epinephrine. I know, that's why I said I know where you're going with it, but that is a different kind. That's different than where I was going with this one. Okay. Now, Adderall is a stimulant, and it works a little bit differently. We'll get into that. Now, what's an antagonist? What medication do y'all think? Just off the top of your head from what you know of the world today. That's a different kind of medication. Y'all went too far down the rabbit hole. Let's keep it surface level, okay? Bro, y'all down in the rabbit hole. Let's keep it simple. Something. Caffeine is a stimulant. There you go.
I thought that works against whatever is negatively in your body.
It can. That's why I said let's keep it kind of simple before we jump down that side of the rabbit. You have to understand some other things before you get to where y'all were going.
You said a medication that works against the body?
No, that works against something in your body. There you go. What does Benadryl stop? There you go. It blocks the histamine process in your body, which helps block itching, swelling, redness, irritation.
So like allergy pills?
Yeah. Zyrtec, Claritin, Zazol, Allegra. Those all block histamines. Okay? They block chemicals in your body that cause you to itch and have allergic reactions. Now, the dose is how much of it you're given. Now, what you see on most medications that are over the counter, those are things that do not require a prescription. Which is like what?
Like 10 milligrams.
Well, it depends on the medication. It can start there. And that's for regular strength. It's 650. So it just depends. Typically, a dose is what is been deemed safe for most people of average height and weight. And they use average height and weight by a body mass index to tell us how much fat typically is in somebody at a certain height and a certain age and weight. So for somebody that is my height in age, they expect somebody to be about 125 pounds. I would look like I am on crack or have cancer. I have not been 125 pounds since I was in middle school. Okay. So where it depends on your body mass index, what is deemed safe across the board. And that's usually about a average 50-kilo person. Okay. And that's usually about somebody that's about 100 pounds. That's what they base what is safe across the board. So basic medication, Tylenol, is safe 500 milligrams for the average size adult with a fully developed organ system. That's it.
I'm having them do that.
Mhm.
But then the rest of it, she's got to get organized. So I just want to make sure
That's the form that she needs.
he's doing these shifts with her.
Okay. Okay. So if it's aspirin for an adult, standard dosing is 325 milligrams. That is one pill, depending on which dose you get. But that's the max dose in one tablet that is safe. Aspirin is 325 milligrams. Now, does it come in other doses? Yes. You would not typically take 325 milligrams of aspirin every day.
You said at one time, though, right? You said at one time.
That's for one pill where it's considered safe. Mm-hmm.
Man, I just learned this. I actually can't take, or maybe possible patient in the future can't take like Midol because I'm already on a water pill that has a diuretic.
And that's true. It could cause excessive fluid loss.
Right.
So it also depends on what water pill you were taking.
Someone might not even know that because they think it's just Midol.
And that's what that is something valid to understand. When you look up the contents of Midol, somebody Google it. Kelly, I know you know, don't say anything. And I know Asia knows. And I'm sure Shanteria and Janae knows. But most of you guys don't know.
I don't take that.
And see, and there is another situation. There are a lot of people who don't. Okay. And the reason I'm having you guys look it up is because you don't know what's in it.
Methamphetamine, caffeine, and lyra. I don't know what that word is.
I'm assuming that's a,
Menstrual cycle.
yeah, menstrual period, drugs.
Say it the right way, and then
I
you
mean,
say
it's-
period.
Yes,
Menstrual cycle.
menstrual cycle.
Okay. And this is why I'm having y'all look this up. Y'all limit some of the sidebar.
I know.
And what's that medication? Let me see. So I'll see how to pronounce
I thought it was
pyramidol.
It's called what now?
Pyrrolene.
Pyrrolene.
Mm-hmm. It is a diuretic. It's a very mild one. It doesn't make you run to the bathroom. I know some of you may have grandparents or great grandparents that may have been on hydrochlorothiazide or Lasix.
That's what I wanted.
Okay, that makes you go to the bathroom a lot more frequently than this medication.
What was the first medication you said that you wanted to look up?
Midol, MIDOL, is mostly used to relieve cramps associated with menstrual periods. You need to know, because if you have somebody say, well, I took so many Midol, you need to be familiar with what this medication is. What are they trying to relieve? Remember, it's for the treatment of disease. Is a menstrual period a disease? No. Does it feel like being female when it's bad? Yes. Yes, it does relieve pain.
Is it like,
Mhm.
was it
I
just
saw a video
aspirin
of a
or
guy.
have other stuff?
I
Mhm.
saw a video of a guy
You
that
said that.
his like head was hurt or something, and he took some Midol, and he was like, "Y'all got that good medication."
Now, the reason he said that, one of the components of the medication is caffeine.
Yeah.
One, caffeine is a stimulant.
You that's crazy though, because when I was younger, I used to have really like real bad cycles, and my doctor he told me stop taking caffeine, like don't take it.
Mhm.
Okay, I didn't know you knew. That's what I'm saying. Okay.
Well, see, the thing is, caffeine is a vehicle that helps get the medication into the cells to help relieve pain. It creates a synergistic effect for your pain medication. So a lot of people think, oh, when I take something for pain, I need to have water. Yeah, it's good to drink water with your medications. Water is universal.
But you should drink coffee.
So is caffeine what is caffeine?
Caffeine is a drug in and of itself. It's a stimulant.
It's a stimulant.
Okay. And like I said, it's a vehicle because most caffeine products have sugar in them. Now, coffee in its raw form does not, but it helps that vehicle get the medication into the cells. So it works better. Okay. So you got to look at how your medication works. What's the onset of action? How long does it take to start working? Then you have your duration. How long does it work? Elimination. How does your body get rid of it? And it's only a couple ways, typically about the 3 standard ways. And the peak. And when is it at its best? It depends on the medication. Some medications, like some insulins, work as fast as 10 to 15 minutes.
Morphine is like 10 to 15 seconds, girl.
Well, it depends on how you get it.
Oh yeah, they had it in the IV.
Well, then yes, it goes straight to the bloodstream, so it goes a lot faster that way. Now, some medications, who takes allergy medicine on a regular basis? What do you take?
Claritin.
So you take Claritin or Claritin D?
Not just Claritin.
Okay, so usually, how long does it last for you?
It say 24 hours, but I'll say like 12. I usually start sleeping like that long in the day. No stuff I'm gonna do.
Okay, and that's standard because they say usually a typical Claritin tablet should last 24 hours. Now, based on his metabolism and how it works in his body and the amount of histamines that he may be dealing with, it may not last that long. That's why it says for him, use about 12 hours, he's sniffing and snotting. And I can agree with that because I go through the same thing. Now, who takes anything for, I don't know, y'all, somebody may be on blood pressure medicine. Do you notice a difference over the course of the day? Do you take it how often?
I take one in the morning. You get a low dose one in the morning.
So have you noticed any difference of if your pressure spikes during the day?
I don't know. I've had high blood pressure since I was like a child, so I really don't know.
Okay. Anton, what you gonna say, baby?
Oh no, I'll take blood pressure medicine.
Hmm?
I'll take blood pressure medicine.
Okay.
But blood pressure, so blood pressure means you keep your blood pressure down. You know,
It depends on how it works. What type is many different types of blood pressure medicines. They should keep your blood pressure down, but some of them help reduce your heart rate. Some block the calcium that's going into your heart. Because if you get too much calcium, it makes your heart beat harder. So it just depends on what type you're taking.
I know lisinopril is a water pill.
It is not.
It's not.
No, it's not.
Which
It is an
one?
ACE inhibitor.
It's a what now?
An ACE inhibitor.
Okay. Is that, which one is it keeps the fluid off of your body also lose the blood pressure?
Hydrochlorothiazide. Or Lasix. Or torocimide. Or spironolactone. It just depends on which one you're taking.
Hydrochlorothiazide didn't work for my blood pressure.
And some people it does not. And that's one of the things. That's why they call it the practice of medicine. They have to figure out what works for you and your body. That's why we have to pay attention to how these medicines work in the body and how they interact.
I know Epicot is like, can be definitely on the liver.
Most medications are.
That's what happened with my when I had got my concussion. Like at first they had me taking like these little small pills like every day, and they said that would reduce the headaches over time. but that shit wasn't working for me. And then that's when they put me on the Proxen.
But what was the small pills you were taking?
I have to look at my medical record and see, but it was just a little bit of small pill. But they like,
You just described about 97% of what's in the pharmacopoeia.
Yeah, I don't know. And then they try like sticking me in my head. That shit was the worst.
Yeah, that's not gonna get it. What were you saying, Tom?
Oh, I know.
Oh, okay, I thought you had your hand up. So duration, we just talked about how long it lasts in the system. Now, elimination, what do you think that means? We already said that's how you get it out of the body, but how? Negative. Mm-mm. Mm-mm. How do you get medications eliminated from your body? Or, okay,
Poop it out.
there you go.
You know, so why they always say, don't, a lot of medications say don't induce vomiting. You know what I'm saying? That's one way to get your system. Why would that be?
That's not necessarily a way to get it out of your system. If some things are caustic or acidic, when you vomit them out, it can erode the lining in your esophagus and cause other problems. So that's why on most medications, depending on what they are, you don't induce vomiting. You have to look at how that medication interacts with the body to know if you can induce vomiting to get it out, or if you need to have something else to help absorb it, which we'll get into that about activated charcoal. It's nasty, but it works. It makes stuff stick to it so your body does not absorb it. Hmm. And then the peak is when it's working its best. That's when your batteries are at the highest life and you get the most out of it, just like with your computer. But then as your charge goes down, it starts slowing down. Same thing with your medication. I didn't hear you.
The peak is when the medication is at its best.
Yes.
So what's the rule for like expired medication? Well, no, because I have some nurses say you can use expired medicine.
You can. That's why I said I'm trying to figure out how to frame this. In a perfect world, you would not use anything past its expiration date. Exactly, and that is why. In the field, after it's expired, it is frowned upon to use. Now, in our everyday life, can we take expired medications? Yes, because if you're looking at your prescription bottle, Kelly, get mine off the desk for me, baby. That's why I'm fixing to get this so I can show y'all where you look at. What they're looking at is the expiration date that is on that prescription. From the date that it's written to the date that it expires is 365 days. Now, is that medication itself still good? Yes, because the bottle that it may have come out of does not expire for 3 years after that prescription has expired.
So the bottle itself is
Mm-hmm. So that's what I'm saying. That's why I had her go get my bottle of my Zofran off my desk. Okay. For like your antibiotics. Now I'll pass this bottle of Elite Advil. Now if this is liquid, what ends up happening is that's a whole different situation. We're gonna get into that's because it's in suspension. But if you look on this bottle, what is it? On here on the side, and all prescriptions have this, it may just be in different spots. Some it may be across the bottom, some may be on the side. But you'll see that it has a fill date. It's usually on the front. Let's see where the fill date is on here. You have a fill date. It's on here. It says it was filled November 24th and 2021. And it has a discard after date of November 2022. That prescription was filled in November of 21. That prescription itself expires in a year.
Okay, gotcha.
But the medication still would have been good. I'll give you just a second. Y'all hold on, we got a emergency on campus we gotta respond to.
Can we come?
Right now I would say, as far as the males, no.